So let's talk about dangling. So dangling is sitting on the edge of a bed before the resident gets up. Standing too quickly oftentimes may cause someone to feel dizzy or they may feel faint. So dangling someone for several minutes, which means sitting them upright and letting their feet dangle off the bed, allows the resident to progress to standing and then walking without feeling faint. Taking deep breaths helps to prevent lightheadedness. Most common signs and symptoms of feeling faint are pale face, complaints of dizziness or weakness. If those things happen, return the resident to a supine position if they have difficulty dangling. If dangling is tolerated, progress to standing. Get assistance if the resident is too weak or unsteady when you help them to stand. Assist the resident to stand by placing your hands under the resident's arms with your hands around the shoulder blades, and use good body mechanics for yourself to assist them to stand. Have residents stand by the side of the bed for several minutes prior to ambulating, which means walking. Return to the bed or assist to the chair if they have difficulty standing. If standing is tolerated, then you may progress to walking. So the effects of the body when you walk: it stimulates circulation, it strengthens muscles, relieves pressure on body parts, increases joint mobility, improves function of the digestive and the urinary systems. It also increases independence and leads to more positive self-image, provides a sense of accomplishment, and prevents lung congestion. So encourage the resident to ambulate as much as possible, and you may suggest the use of a handrail for support. If the resident starts to fall, ease them to the floor by grasping a gait belt, resting the resident's buttocks against your leg, and then sliding them down your leg to the floor. Be prepared to assist but not allow the resident to do as much as possible. So some things to consider is to use the gait belt. Get help if you need it before you start. Allow adequate time for walking so the resident doesn't feel rushed. That can lead to a fall. So let's talk about cast care. Casts are used to immobilize body parts, and it provides time for the part to heal. Some of the materials are plaster of Paris, which takes 24 to 48 hours to dry. It expands and gives off heat while it dries. Fiberglass dries rapidly, and it's lighter than a plaster cast. And then, of course, we have plastic. So we have to allow all casts to dry by air. Keep them uncovered. Use pillows to support the cast. You can see that right here. And support the cast with the palms of your hands. Never put pressure on a cast. Turn in position frequently to allow the air to circulate around the cast. Maintain good body alignment, keeping the cast dry. Observe a cast for rough edges, and if you find any, report that. An over-the-bed trapeze, as shown here, can actually provide some support if needed. So things to report: if your resident vomits, which means throwing up, has an elevated temperature, skin irritation around the edge of the cast, drainage, odors, swelling of fingers or toes, or an inability to move apart, change in color of the skin, paleness or cyanosis, pain, numbness, tingling sensations, chills, hot or cold skin, itching, tightness, the inability to move fingers or toes, or even nausea. So we're going to talk about coughing and deep breathing. The purpose is to prevent respiratory complications in certain at-risk residents. Persons on bed rest or reduced activity tend to have lung congestion, and our goal is to reduce that. Patients following surgery can have lung congestion, as well as people with respiratory disorders. So the purpose: two major complications that are prevented by coughing and deep breathing are pneumonia, which is inflammation of the lung, and atelectasis, which is collapse of portions of the lung. So the physiology behind deep breathing is it increases the level of oxygen in the blood, which then increases lung expansion. So when you cough, you're actually removing mucus from your airways and lungs.
For reference, please call the front office. Tabitha Wilson, please call the front office. Thank you.
And it may cause collapse of the lung if congestion is not present. So considerations with coughing and deep breathing, doctors order these exercises. The frequency of performing the exercise varies per the doctor's orders. And the nurse aide receives instructions from the supervisor, and sometimes coughing may cause pain and be difficult to perform. So let's talk about an anti-embolytic stocking or hose. Their job is to provide support, comfort, circulation by providing pressure, and reduce the risk of thrombus formation. We use them for residents with heart disease and circulatory disorders, residents that are on bed rest who cannot walk, and residents who recently had surgery. The prevention of blood clots, multiple blood clots, is called a thrombi. Blood clots form when the blood flow is sluggish, and it usually develops in the deep leg veins, and it can break loose and travel through the bloodstream, and then it's known as an embolus or an emboli if there's multiple. How do we prevent them? So embolus can travel to the lungs and it can cause death. Elastic stockings exert pressure on the veins, promoting venous blood flow to the heart, also known as anti-embolytic stockings or TED hose. How do we fit these things? So they come in thigh-high or knee-high lengths, just like pantyhose. The resident must be measured to ensure a proper fit.